let's quick talk a little bit about other kind of damage that you can receive from nose surgery. Damage that the doctors won't mention to you. So it's unfortunately there are some pages here I haven't translated them to English, but this is adhesion, and if the surgeon don't put packing inside the nose after the surgery, the wounds can heal in a way so that for example the middle turbinate here can connect to the septum and to the lateral wall, and that could cause a lot of pain, and it's also a risk to fix that afterwards. Next injury that can happen is a septal perforation, and that can happen if the surgeon removes too much cartilage during a septoplasty. If he removes too much, there will become a hole, and that hole can become infected, and bacteria can enlarge the hole, and it's not easy to fix afterwards. You can try to put a plastic or a rubber button, but it won't be perfect. Another reason for septal perforation is also if the surgeon destroys the septal mucosa during the septoplasty. If he tears the mucosa, the cartilage within the septal wall will not get nutrition and blood supply. So in time that cartilage will die and a hole will appear, and that hole can become very large. Some complications you can have is disturbed airflow in the nose. You can get the whistling sound, the mucosa will become dry. You can get bleeding, you can get crusting, you can get the nasal obstruction, or at least it feels like nasal obstruction because you have destroyed the thermoreceptors, the nerve endings in the septal mucosa. And you can get a nasal collapse with an appearance change of the nose. I'll leave to you to read the rest yourself here. Another thing that can happen to you when you have partial or total turbinate reduction with scissor and scalpel is that you can have a hole into your sinuses, into your maxillary sinus. So the thing is that the surgeon, he cuts this part and removes the tissue, and he uses a tool like this one here, and he bends and break off some parts, and if he comes too close to the wall here when he's going to remove the turbinate bone, he can easily by accident remove some parts of the wall here, and then you have a hole into your sinus, and that you can't do anything about that. In my case, this hole is quite small. I haven't been able to measure it really, but I would say it's probably not bigger than a 1.5 centimeters or something. But I think in some cases the entire wall is gone between the nasal cavity and the sinus, and of course that will cause you a lot of problems, and you can't do anything about it. So this again is another reason to never ever have partial turbinate removal or reduction with scissor or scalpel. If the surgeon, in my case for example, had been using radio frequency, this could never have happened, or the likelihood of it happening would be extremely small. So yeah, that method is so fucking stupid. And here we have some images of my nostril 4 years after the surgery. The damage you see here and the damage I'm going to explain is not directly from the surgery, but it's secondary to the surgery. So like I've been saying to you, if you remove the turbinates, you also destroy the immune system of the nose. The nose will always become open, and that will cause dryness, and that dryness eventually can cause inflammation, infection. So you see the white part here, that's not how a mucous membrane should look. This is either inflamed or infected, or there is some kind of degeneration, and during this time, and I still have problems with pain and discomfort in the nose when I breathe. It burns. It's a little bit better now, but it still burns, and during this time I had tremendous pain. It burns and I was extremely dry. The mucous membrane was bleeding. So that's a secondary damage, and the more you destroy on the turbinate of the turbinates, the bigger chance, the bigger risk there is that you will have this problem. And here is also another problem that can appear. So if you remove the turbinates within the green circle here, the inferior turbinates, there will be a jet stream of air flowing along the nasal floor, and that will hit the back part of the nose. It will cause dry throat. It will cause a lot of discomfort here, pain. It will cause a wound to appear, and eventually you'll have scarring, and that's what you see here. This is the back part in my nose, and the white is scarring. Let's talk a little bit more about septoplasty, and specifically the consequences on the septal mucosa. Most people don't think about this. They just sign up for septoplasty and don't understand that this will affect the status of the septal mucosa. Most often, but very often, the septal mucosa tears. And if we look on the right image here, we can see on the left side you have the cartilage wall, and on the right side here you have the mucosa and the perichondrium layer. So to be able to perform septoplasty, you need to remove the mucosa from the wall here. And when this happens, it's very easy that the mucosa will tear, and I'm going to tell you a little bit more about that later, the consequences. But if we look on the left image first here, we can see that the cartilage wall on this side, and then we can see that there are a small thin layer called the perichondrium here. And on the other side, on the left side here, we have the septal mucosa. And this is quite common that the surgeon fails to remove the septal mucosa and the perichondrium together as one layer together. If he removes just the septal mucosa and leaves the perichondrium, or partly leaves the perichondrium somewhere, it's very easy that the mucosa will tear. Because most strength is in the perichondrium layer. So without the perichondrium, it's very easy that you will have a tear. And if the tear is in a horizontal level, is not good, but it's better than if it's in a vertical line. Because many blood vessels, they go from the back side in the nose to the front side. And if you tear the mucosa vertically from the top to the bottom to the nasal floor, you will destroy many more blood vessels, many more nerves and everything. So it's not good either way, but horizontal tear is less bad than a vertical one. Also, you can look on the right image again, and you can see the septal mucosa here is quite thick now. But after septoplasty, it's very common that this mucosa become paper thin. It's just there's no thick blood vessels within anymore. There are only small capillaries, and yeah, the mucosa will become dry and numb. It can't swell up anymore together with the turbinates, so it will become just passive, inactive, and yeah, you will have problems. The nose will become open. Another thing that also can become destroyed is the septal swell body. I've been talking a little bit about that before, but the septal swell body is an area up here. Sometimes it's called the fourth turbinate of the nose. It's an area that have a lot of blood vessels, and they have a lot of goblet cells that produce mucus. It has a lot of thermoreceptor nerve endings, so it's important to sense the airflow. It's important for the immune system in the nose, and it's important to regulate the airflow to the upper part of the nose. And it does this in combination with the turbinates and the other parts of the septal wall, the septal mucosa. So when those parts swell up, the septal swell body also swell up, and vice versa. So a very common reason to have a septoplasty performed is if you have a septal spur. A septal spur, it's something that could be normal because many people have it, and it's a ridge between. You can see here that are 3 plates, so they crash together and form a ridge, more like similar to how a mountain range is shaped and designed. So yeah, and this ridge can go all the way back here to the middle turbinate. So if it goes all the way back here to the middle turbinate, that means that the surgeon need to remove the mucosa from the septal wall all the way back here. So there will be a really big area of the septal mucosa that will be affected from the septoplasty. And the bigger area, the more problem you can have, especially if the surgeon tears the mucosa. So if we look on the location of the septal swell body, we could see it here on an X-ray up here first. And I have made a circle here, so you can see on this image. So the septal spur is located here. So it's really close to the septal swell body here. So yeah, and you need to remove some extra cartilage, some extra septal mucosa here as well. You can't just remove it close to tight around the septal spur. You need to have some extra room to move around surgical instruments. Yeah, so in my case, the septal mucosa has become paper thin. My septal swell body is, it's more or less totally destroyed. I have explained this, and I've showed images on this in this video here. You can see up to the left here. So if you want to know more about this, you can watch that video. But if we look on the right image here, we can see the septal mucosa to the right here. First, it should be shaped in an arc like this, and it's not longer shaped like that because surgeon probably removed cartilage up here, and you can see where the septal spur was located before, because it's kind of like a trench here now. And you can see some probably old parts in here from the septal spur, and the mucosa is so thin now so that those parts almost perforate the mucosa. So in my case, this mucosa here is passive, it's inactive, it doesn't have any bigger blood vessels anymore. it can't swell up anymore. So the nose is just extremely open all the time. It's dry. I have no airflow sensation here. So he probably has also teared some nerves. And if we look on this image, this is my x-ray before the surgery. You can see here was my septal spur, and here's the location of the septal swell body. So you can see how close it is to the septal swell body. So of course this area will be affected. And this image to the left here, you can see before the surgery how thick the septal mucosa was, and this is after. It has become extremely thin. And this image also shows a little bit here that part is shaved. So yeah, this is something you need to understand also before deciding about having a septoplasty or not. So some other complications that the doctor won't mention to you. In my case, the appearance of my nose changed for the worse. So you can have asymmetry of your nose, bumpiness. You can have a narrower nose, at least in the middle part of the nose. You can have a valve collapse. I have a small valve collapse. I'm going to show you images on that later. You can have a septal perforation. I've been telling you about this before here. It could be directly from the surgery if the surgeon removes too much cartilage, or it could be afterwards if he tears the mucosa on both sides in left and right nostril. If he performs septoplasty in left nostril and in the right nostril, and if he tears the mucosa on both sides, the cartilage structure will not get nutritions anymore. So in time it will die, and a hole will be created, and that hole could be extremely large. And yeah, there's nothing really you can do about a large hole. Small holes you can fix maybe, but anyway the mucosa will become thin, numb, and non-functional. And yeah, the septal swell body, I told you about that before. So I leave for you to read the rest yourself here. If you go for the next, this is my images here, so you can see this is how my nose looked before the surgery. It's quite even shaped here, and this is how it looks after. And in my case, it wasn't too bad. I have seen people who have become extremely much more damaged by the surgery. So I have a small valve collapse here. My nose has become more narrow here as well. It's not as wide as before. So yeah, this is also something you need to understand, something that the doctors won't tell you.